Good afternoon and welcome to the Wavy Digital Desk. I'm your host, Sarah Good. Today we're going to be talking about the post-COVID clinic that's at Sentara Heart Hospital. It's run by Dr. Chow, and he's going to be with us today to talk to us more about what is going on at the clinic, patients, what the developments really have been in the last few years since it was developed during COVID. So I'm going to bring him on now. Dr. Chow, thank you so much. And just to give a little information just about you, you are a pulmonary and critical care physician at Sentara, and you also started this clinic just about, I guess, 3 years ago now, really, right? 2021?
Yeah, it's actually a little bit earlier than 2021, but then in the fall, late fall to early winter of 2020.
And I guess I'm curious, what that starting period was like. At that point, the onset being March 2020, you're going to see people obviously in those months out, from possible infection. What was really the initial thought, I guess, or process in developing the clinic?
That's a great question, Sarah. So when we started the clinic, our intent was to help the patients who were hospitalized and had significant changes in their in their lung structure. We were concerned that they were going to end up with scarring of the lung, and we wanted to make sure that they were going to be leaving the hospital with appropriate follow-up at the time. And so that was the initial intent of the clinic.
And were you seeing a need? Obviously we know the hospitals were overwhelmed at that time. Was there a need to treat these patients as opposed to, in the average maybe COVID unit or so in the hospital, but to have a separate place to sort of take a look at maybe these longer lasting illnesses?
Absolutely. So when we were starting this clinic, the news of long COVID was just kind of permeating into the literature and into the medical field. So again, it was in the late fall of 2020. So we were kind of experiencing those first two waves, and then patients started having more continuous issues afterwards. So the clinic provided them an area to kind of help along the recovery after they were discharged from the hospital. And at those times, people were being sent home on a lot of oxygen. They needed help getting off the oxygen, trying to figure out how much oxygen they should come down on ever so often. And then there were patients who ended up with scarring of the lungs, and then they needed that to be evaluated and followed up on.
Absolutely. And I think there has been quite a development, obviously, in the last 3 or 4 years of what this looks like. Can you just talk a little bit about what this post-COVID illness, or also known as long COVID, is?
Absolutely. So the long COVID, first, the name is kind of interesting because it kind of comes from a patient who was wearing a long haul trucker hat when she was thinking about it, and then she kind of posted it on Twitter, and then everything kind of fell after that. So what I usually tell my patients is that long COVID is not necessarily a diagnosis in itself. What it is a combination of symptoms and signs that we see in patients after they've had an infection with COVID-19. And so that could range from any number of things that they experience, and it literally can be from head to toe. People have had hair loss, joint pains, memory issues. And so people often equate COVID with shortness of breath. And so they think that long COVID is also just shortness of breath, but that is not the case. It is a wide variety of symptoms that follows.
And I know that some of these symptoms obviously overlap with other diseases. They can overlap with maybe pre-existing conditions before you've had COVID. How do you go about sort of, isolating the post-COVID from maybe some other things that they could be diagnosed with?
That's a great question, Sarah. So that is the heart of what we try to do at our very first visit with our patients. Our visits during the first visit usually last at least an hour. With our patients, and it's a lot of questions going back and forth between us and our patients. We ask our patients, what are some of the top symptoms you want to talk about today? We recognize that there are a large number of things that they may want to talk about, but we want to focus on the most concerning things for them. And from there, we ask a lot of detailed questions to try to elicit what is or what may be the underlying problem for this. So a lot of patients have fatigue, shortness of breath, and so they may not feel, and they feel just tired all day long. And what we found was a lot of our patients were having new onset sleep apnea, or they were having oxygen deficits while they slept. And when we gave them oxygen, they felt somewhat better. When we put them on sleep apnea machines, they felt somewhat better. And then there are other symptoms that then we have to kind of attack and try to figure out what's underlying for that too. So a lot of questions for the patients and some testing too.
Absolutely. And I imagine it's difficult because, unlike COVID, there isn't this perfect test that you all can use on your patients to sort of figure out exactly what's happening.
Yeah, that's absolutely true. So I wish there was a simple test that we could just throw out there and say, yep, you have long COVID, and these are the reasons why you have long COVID. But then the other things are COVID can exacerbate a pre-existing condition, just like you said. So we had, some patients who have had an autoimmune disease or an inflammatory disease within their body to start with, and then they get COVID. And while those things were well controlled initially, after COVID, they would have a terrible exacerbation of that disease process, such as rheumatoid arthritis or some underlying condition that they didn't even know about that they had, that they may have had.
And it's just, baffling, I think, too, because some of the process, it seems, is you do have to be an advocate for yourself, maybe that you're not feeling well, whether it's the brain fog, whether it's the general malaise, as you were talking about, or sort of weakness or tiredness after activity. And those can be really debilitating, for everyday activity and everyday life.
Yes, that is one of the big complaints that all of our patients have, or most of all of our patients. And so that the deviation from norm in their exercise capacity is significant, and because of the patients that are affected, can be a wide range of patients, not just someone who is much older, but also the younger patients, the middle-aged patients, and so those who were doing significant exercises previously, CrossFit or some other training that they were doing, they they may have it, and then when they come back after COVID, they can't do that, and it's kind of depressing for them too. And then not just physically, but also mentally. When patients after COVID and they can't think correctly, they can't do the tasks that they were able to do before. Multitasking becomes a really big issue sometimes. And patients say, I used to be able to do so many different things. I used to have this job that I did, and now I can't do it. So all of that can be very debilitating and also very depressing.
And I heard too, so in 2021, about, just a little bit after, obviously, when the clinic was developed and hopefully other clinics across the US, but it was added as a recognized condition that could result in a disability by the Americans with Disabilities Act. I mean, for you on your end, how huge is that development to make sure that that is at the same time, when maybe treatments are coming into place or we're starting to begin to know more?
So one of the things that I'm doing more often after I started the clinic than I did previously was fill out disability paperwork, and it's really disheartening for the patients sometimes to kind of have to go through all of that, and then to be recognized. I think it's a major step forward. Now you have to ask a lawyer specifically for this, but I think there is a little bit of a difference between what they're recognizing as a disability and what workplaces recognize, the labor unions and
Interesting.
forces kind of recognize as a disability from their work. So as much as we can advocate for our patients, there are long-term disability companies when we try to get our patients long-term disability, they send them for second and third opinions. And unfortunately, one of the things that happens is these patients do not always have, most of them don't have specific tests that show you that, yes, this is a disability. I often say that if you have a broken arm, you can see that really easily. But what's happening is inside of our patients, and we can't always see that.
And that brings me to a question, just about duration and sort of different symptoms and different, pathways forward for these patients. In your experience, I guess, just to talk about this clinic, what has that been like? Has there just been such a variation in patients maybe having symptoms for, a finite amount of time versus patients now experiencing symptoms for years? I mean, just tell us a little bit about what you're seeing.
Yeah, so we are seeing kind of what you said, a variety of duration for our patients. There's not necessarily a rhyme or reason as to the duration. It seems that every time our patients come in, we do a quick calculation of how long ago was their infection, and we put that number in our notes. And I've seen some numbers that are pretty high and some numbers that are pretty low, but I don't have something that I can use to calculate exactly how many days they're going to have these specific issues. And then the other parts of this is, again, if we can figure out the underlying problem, that'll allow us to solve the problem sooner, right? So if someone is fatigued during the day because they have new onset sleep apnea, we can fix that pretty quickly by getting them some oxygen or putting them on a sleep apnea machine.
And in terms of those patients that you're seeing, I guess the other side of it is, are these patients that are needing around the clock care? Is it inpatient? Is it outpatient? Is that a mix as well?
So what we do in the clinic are strictly outpatients. They're not always requiring around the clock care. Some of them are able to go to work, but they need specific restrictions so that they are not so tired by 2 o'clock that they're requiring to sleep for the next 16 hours. And so there are patients who can't go to work because not because they physically can't sit there, but because the stimulation from work is too much for them to be able to concentrate and do the work that they need to do. And they're concerned that they may miss something and then something bad can happen.
I think that is, it's a lot to handle as a patient, I guess, trying to get better and then also balancing that as well with your work. And we've heard that obviously through the course of time in a lot of different ways, a lot of different illnesses, especially the ones, as you mentioned, that can't be seen as physically. I did want to ask you as well, with your patient stories over time, have you had patients that have continued to need to come see you throughout these last couple years? Or, have you seen success with different treatments and sort of mitigating those symptoms?
So I think for the vast majority of our patients, we have seen some sort of improvement, uh, a little, or even to a point where they've improved so much that they didn't need to come back anymore. So that is the encouraging part. As I was thinking about this, um, Wavy 10 actually did a report in 2021 on one of our patients, Jonathan Cotton, who was a nurse anesthetist, and he was interviewed by you guys. And at that time, he was very much into, in the midst of long COVID. I actually saw him, a little while ago, and he's doing much better, and he's able to do the things that he likes now and loves.
And that is linked as well. There's a link on Facebook and YouTube and on wavy.com. And I've linked back to that 2021 story that Stephanie Hudson did. It's great to hear, obviously, that there are some improvements. And, I guess the stats for this and the data that's been collected, it's interesting, in preparation to speak with you. I looked back in 2022, there are some stats from the CDC. And then 2023, you see some studies. But I think across the board, they just say, it's vastly underreported, maybe how many people actually have experienced long COVID. I mean, does that sort of go with maybe what you're seeing in person?
Yeah, absolutely. So the challenge to this is, number one, recognizing both from a patient and a physician side that this could be long COVID. Now, how we kind of approach that long COVID versus the underlying diagnosis, that may not necessarily change, but it is important, because I think the recognition for the patients is important. Um, and so um, there are patients out there who may not have the time to go to the physician's office because of the symptoms. It may not be so challenging that they need to be seen by a physician, but they're still having these symptoms. There are still people out there who may have seen someone, and there's a misunderstanding of what long COVID is, and who can and cannot get long COVID. So those are all things that I think everyone can do a better job in terms of the education to recognize it.
Absolutely. And there's a interesting question in the conversation here, at least on Facebook, that I just wanted to ask to you because it was part of, prepping for this too. But what can we do as a community to support long COVID patients and then also to support the work that you all are doing at Sentara?
So to advocate for my patients, I think the biggest thing is for the general public to kind of recognize that long COVID is a real process, whether it's physicians, whether it's employers, whether it's the employees themselves, the patients themselves. And you may not see it on the outside, and that is the key. Almost unequivocally, all of my patients have said, everybody sees me and they think I'm fine on the outside, but on the inside, I know I am not. I am not the same person as I was before. That's these people are not just trying to fake something and trying to get something out of it, but when they're in the midst of all of that, it's a real process, and if they're not able to have that sort of acknowledgement or have that talking to people, that it can be very distressing on their psyche, and it can cause some anxiety and depression. And so we've seen that in some of our patients.
I mean, it's hard to imagine, I think, when someone isn't feeling well, but also to advocate for themselves, not only just maybe at the doctor's office, but obviously also in their community. I think, having a post-COVID clinic here in Hampton Roads and someone that is looking at the full picture is something that everybody wants. And I think another piece of the clinic, too, that's interesting is you obviously have this wealth of resources at Sentara. So if it is a specific issue coming from the post-COVID illness, it looked like it online, at least, correct me if I'm wrong, that you're able to refer or maybe figure out another, doctor or specialist or somebody to sort of maybe pair with you all.
Yeah, the more the merrier to kind of help along with this path. I think so. We can certainly use more people to kind of help us along and pair us up, and because the clinic does have a pretty large population of patients, and we do have a backlog of patients on the wait list to be seen. So it is a challenge to get our patients in sometimes.
And is that, do you think, a regional health problem that you all are one of the only post-COVID clinics that really specializes in this?
So probably. So the challenge to this process is that there's really not a lot known about it, right? So it can be a challenge to both the patients and physicians, and so it can be quite frustrating sometimes for everyone involved. Why isn't my patient getting better? Why can't I make them, at least a little bit better? And so there is no guideline for us to follow, right? So if someone has high blood pressure, you have a guideline that you can follow. If someone has a pulmonary nodule, you have a guideline you can follow. If someone has long COVID, it's a lot of detective work and not a lot of guidelines.
And in terms of people maybe questioning, as you said, if it's real, what it looks like maybe from the outside, post-viral illnesses are nothing new, right? So this is not something that, I know that we're talking about post-COVID illness, but post-viral illnesses, they are not new.
Yep, that is correct. There was a diagnosis code for that long before COVID. So, for example, you mentioned EBV, right? Mono. You can have reactivation. You can have, even if it's not a viral process, Lyme disease can cause that too. The fatigue that sets in afterwards is real. I think just the fact that COVID hit so many people that it's now a much more recognizable process, and people are becoming more aware of it. So I think one of the interesting things is that when COVID first hit, one of the biggest things that everybody realized was that, hey, if I lost my smell, I might have COVID. And so kind of everybody associated with the loss of smell to COVID. Um, and so, um, but what people may not have realized is that it can also be associated with the flu or some other viruses that can cause the same thing. But the number is so small compared to the vast number of COVID patients that it was just not really reported that much.
Interesting. So we'll probably have to see too, I guess. I know this is years and years of research later, but really what this looks like. I guess I'm curious, just to look ahead and jump ahead to the future really quickly. Is there anything you're seeing in the research world or things maybe that you're hoping for in the research world that will come down in the next few years?
I think what I tell my patients is, you know, everything takes time. And so I understand that, COVID kind of came in around 2020. It's been 4 years, and we still don't have an absolute answer to long COVID. But in the long term, this is not a prolonged period of time for us to understand disease process. I think one of the more interesting, there's probably more and more data now that shows some sort of dysfunction from the mitochondrial process or dysautonomia process where the nervous system is kind of not operating correctly. And people's heart rates go very fast, very quickly. And then the mitochondria, which kind of helps us utilize oxygen to make energy, that may be not working the same in patients who've had COVID infections versus those who didn't.
And that's interesting too. And I know that we're running out of time here, but I guess one of my last things I wanted to ask you too is about, moving forward as people, get boosters and vaccines and they treat COVID now in a different way than they did, during the pandemic with incubation periods and different viral treatments, et cetera. How are you, I guess, hoping people react to all of that? Are you hoping people take, COVID seriously as when they have it? Does that help their, I guess, potential for not getting long COVID? Having milder COVID cases. Have you seen a link, or I guess, what do you what do you even tell them right now? I don't even know exactly where the science is, but what's the latest on that?
In terms of trying to prevent or mitigate the amount of long COVID someone has, there's some, you know, of course, data out there is going to be mixed, but the vast majority of the studies that have been published so far show that having the vaccines does kind of decrease the amount of long COVID likely too. And it may be dose dependent, but I think we need more time to kind of verify that and make sure it's real. The other thing is the strains are constantly changing. And so by the time the papers are published, it may not be the same as before. And so if you got a vaccine that doesn't cover the new strains, then the long COVID process can still hit you like someone who wasn't vaccinated, possibly. So again, things are changing constantly, and it's just a matter of being able to pivot and shift our focus as almost as quickly as the virus shifts itself.
And as a community member or as somebody, whether they're watching this regionally or if they're watching this across the country, what's the best thing for them to do? Is it still trying to mitigate your individual COVID risk when possible? Is that, wearing a mask when you're sick? I mean, are there any sort of just day-to-day things people can do, maybe not in preparation to help for long COVID, but certainly just to maybe leave the world a little bit hygienic?
So I think it's very appropriate that you said as a member of the community, because that is the key to kind of mitigate this from the start. And so if you're feeling sick or if you're not feeling well, wearing a mask will help other people from catching COVID or the flu or any other viral infection that you may have. I know that the recommendation is that you can go back to work now, but it may not affect you as much, but you don't know what your coworkers are having as a comorbidity, right? Other disease process that they may have that can put them at risk of having more severe process from the COVID infection. But again, if you're not feeling well, don't go to a large gathering. Wear a mask. Washing your hands is always important. And so these are the basic things that we can do to help the community as individuals. You, if you can wash your hands before you touch your face, before you eat and stuff like that, that'll be important. And then also getting vaccinated does help mitigate some of those risks also.
Well, Dr. Chow, thank you so much for joining us today. I think it's really interesting, and if anyone's joining us later before, they can watch this whole conversation back, but to know that there's such a need, obviously, for the post-COVID clinic still. There's, a waiting list that you mentioned, to be a part of the clinic. I think the last thing I just wanted to say is if somebody's experiencing post-COVID symptoms and they're not able to get into the clinic, or maybe they do not live around here, is the best thing, is it advocating for yourself at your doctor, maybe writing a list of symptoms?
Yeah, so I think writing a list of symptoms and being specific about them, as specific as possible. If you're having a cough, when are you having the cough? Are you having it after you eat? Are you having it while you're sleeping? Are you having it after you lay down? We get into the nitty gritties here for the questions, and I think it's super important. And so if the patients can provide as much detail about their shortness of breath, cough, and fatigue and things like that, that'll save their physicians a lot of time in terms of the need to ask, and it'll help them along the visit that day to kind of figure out what it is.
Great. Well, Dr. Chow, thank you so much for joining us today at the Digital Desk. I think, all of this was really helpful, I think, in maybe even debunking, hopefully, some symptoms that people have and make them more, or encourage them, I guess, to say, to actually have the conversations with their doctor or their loved ones about maybe the help that they need.
Absolutely, Sarah. And thank you for having me, and thank you for giving me the opportunity to talk about it. And thank you for advocating for our patients.
Absolutely. And last thing, I just want to tell everyone watching, go to wavy.com. There's more information linked. You can find out more information about the resource at Sentara, as well as the latest from the CDC and so much more. So head over to the link that is online right now, and we'll have more on that article later today, right after this live. But thank you, Dr. Chow, and thank you to everybody that tuned in.
Thank you.